this video, the Center for Teaching at the University of Veterinary Medicine Hannover will demonstrate the placement of a vertical mattress stitch in the form of an interrupted suture. The focus of this video will be on the technique of the suture. As the name suggests, interrupted sutures are placed and fixated singularly. This has multiple advantages, such as a simpler placement and a more secure closure of the wound, since if a single stitch opens, the rest of the sutures remain intact. Furthermore, individual sutures can adapt better to irregular wound shapes. This technique does, however, come at a higher material and time cost, as well as causing a stronger tissue reaction. When placing interrupted sutures, the stitch should always begin on the side of the suturing hand. During the vertical mattress stitch, the needle passes through both cutis and subcutis until the fascia or muscle is reached, as depicted here. The schematic illustration shows the needle or suture path created while placing a vertical mattress stitch. The distance to the wound and between each individual suture is dependent on a variety of variables. Among those are the species of animal, the individual patient, as well as the state of the tissue. Since the focus of this video is the general technique, these variables will not be considered. The vertical mattress stitch is a common suture technique on the flanks of cattle or after a caesarean section of a pig. In general, tissue which is exposed to higher tensions, for heavily traumatized tissues, or larger wounds in need of closing are all prime candidates for this technique. The reason for this would be the strong tension distribution, the minimal effect on surrounding tissue, and the better supply of blood to the wound edges in comparison to the horizontal mattress stitch. The vertical mattress stitch is, however, more time intensive. Needed for the skills lab exercise are a suture pad, a needle with attached suture thread, gloves, a pair of anatomical forceps, a needle holder, a pair of surgical scissors, as well as a pair of ligature scissors. The required needle is an atraumatic suture needle without an eyelet. Instead, the thread is connected to the needle directly. This creates a smooth perforation of the skin during suturing, which is gentler on the surrounding tissue. Therefore, an atraumatic suture needle is better suited for fine, delicate tissue, such as internal organs, blood vessels, or skin. Traumatic suture needles come separate from the thread, meaning that the suture material must first be threaded through the needle's eyelet. Due to the wider eyelet and the folded thread, a larger trauma of the tissue is created. Traumatic suture needles should only be used for more robust tissue, such as muscles or fascia. Note for the procedure. When suturing a live animal, the large needle crosses over the wound in a singular action, without grasping the needle inside the wound again. This means that the required needle size is dependent on the species and individual patient. For practice purposes, a small needle is used on the Skills Lab simulator. The needle holder and suture needle are held in the dominant hand, with the suture thread collected in the palm. The stitch begins on the side closest to the suturing hand. A right-handed suture will be demonstrated. In the first step, the wound gap is lifted with the forceps. This allows a view onto each of the tissue layers, which are depicted as follows. Beginning at the top is the cutis, then the subcutis in red, as well as the fascia and muscles, represented in white. When placing a vertical mattress stitch, the first passage occurs further from the wound gap, diving vertically through the cutis and subcutis and into the fascia or muscle. The needle is held with the forceps, allowing the needle holder to grasp the lower third of the needle. In the following step, the other side of the wound is lifted with the forceps and the needle is passed from the inside up through the layers of the skin. The needle can then once again be grasped with the forceps, placed into the needle holder, and pulled through entirely. The needle holder should fixate the needle in the position required for the next step. If at all possible, the needle should not be held at its tip, as this quickly dulls it. When pulling the thread through, the thread should only be held with fingers. The next steps run parallel to the previous. For this, the needle is turned 180 degrees and a perforation is made closer to the wound's edge. It is vital for the returning suture to remain only in the outermost layers of the skin, the epidermis. The begin and end of the suture should now be laying directly next to each other. It is important that the lower pass of suture material is tightened first, as to prevent the creation of a cavity in the wound. The vertical mattress stitch can now be completed with a surgical knot. Finally, the suture ends can be shortened to 1 scissor blade width. Once the wound is fully healed, the sutures can be cut and removed with a ligature scissor. For repetition, the placement of a further vertical mattress stitch will now be demonstrated.